Welcome to the 5th week of your pregnancy. By now, you might be feeling the early signs of this exciting journey. Or you could still be waiting for clear symptoms. In today's video, we'll cover what's happening in your body during week 5, common pregnancy symptoms, and crucial steps to take for your health and your baby's development. This week marks the start of your baby's major developmental milestones. At just 5 weeks, the embryo is about the size of a sesame seed, and while it may seem tiny, critical changes are underway. The neural tube, which will later form the brain and spinal cord, is starting to close. The heart, although still developing, begins to beat and circulate blood. The placenta, which will provide oxygen and nutrients to your baby, is also forming. You may not feel these changes yet, but your body is working hard to support this new life. The 5th week is crucial for the development of your baby's major organs, so early prenatal care and making healthy choices now are incredibly important. Common symptoms in week 5. At week 5, many women start to experience noticeable pregnancy symptoms, though it varies from person to person. Here's what you might encounter. Fatigue. You may feel unusually tired as your body adjusts to the increased levels of hormones, particularly progesterone, which helps support the pregnancy. Sore or tender breasts. This is often one of the earliest signs as your body starts preparing for breastfeeding. You may notice that your breasts feel fuller and more sensitive than usual. Morning sickness. Though the name suggests this happens only in the morning, nausea can hit at any time of day. Around 70 to 80% of pregnant women experience some form of nausea, often due to the rising levels of HCG, the pregnancy hormone. Frequent urination. You might find yourself running to the bathroom more often, thanks to increased blood flow and pressure on your bladder as your uterus expands. Heightened sense of smell. Strong smells, whether good or bad, may become overwhelming. This sensitivity can sometimes trigger nausea. Light spotting or cramping. Mild cramping or spotting, known as implantation bleeding, may still occur this week as the embryo settles into your uterus. However, if you notice heavy bleeding or severe pain, consult your doctor immediately. What to do in week 5. This is an important week for both you and your baby, so taking the right steps is essential. Here's what you should focus on during week 5. Start prenatal care. If you haven't already, schedule your first prenatal appointment. This is when your doctor will confirm your pregnancy, check your health, and give you personalized advice on what to expect in the coming weeks. Take prenatal vitamins. Make sure to take prenatal vitamins with folic acid, as folic acid is crucial for preventing neural tube defects. It's recommended to take at least 400 micrograms per day. Maintain a balanced diet. Eating healthy is essential for your baby's development. Focus on a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Make sure to include calcium-rich foods for bone development and iron-rich foods to support the increased blood volume in your body. Stay hydrated. Drinking plenty of water helps maintain amniotic fluid levels and supports increased blood circulation. Avoid harmful substances. Steer clear of smoking, alcohol, and drugs, as they can have serious negative effects on your baby's development. Even certain medications can be harmful, so talk to your doctor before taking anything over the counter. Get plenty of rest. Fatigue is common, and your body needs time to adjust to the changes of early pregnancy. Don't hesitate to take naps when you need them, and try to go to bed earlier. Exercise carefully. Light exercise, such as walking or prenatal yoga, can help improve your mood and reduce stress. However, it's important to avoid strenuous activities. Always consult your doctor before starting any new workout routine. Common misconceptions about week 5. Let's address a few common misconceptions about week 5 of pregnancy. You should eat for 2. While your baby is developing, you don't need to double your calorie intake just yet. In fact, overeating could lead to unnecessary weight gain. Stick to a healthy diet with moderate portions. Morning sickness only happens in the morning. As we mentioned earlier, nausea can strike at any time of day, not just in the morning. Spotting always means a miscarriage. Light spotting during early pregnancy is common, but if you experience heavy bleeding or intense cramps, consult your healthcare provider. Frequently asked questions. Here are some frequently asked questions about week 5 of pregnancy. When should I take a pregnancy test? By week 5, most pregnancy tests should give you an accurate result. If your test is positive, it's time to schedule a prenatal visit. Is it normal to not feel symptoms yet? Yes. Some women don't feel any symptoms at week 5. Every pregnancy is different, so don't worry if you don't have morning sickness or other symptoms right away. Can I exercise during week 5? Light exercises like walking or swimming are generally safe, but avoid high-impact activities. Always check with your doctor before starting a new exercise routine. When should I see a doctor? You should schedule your first prenatal appointment around 6 to 8 weeks into your pregnancy. But if you experience any severe symptoms like heavy bleeding, sharp pains, or dizziness, contact your doctor immediately. Week 5 is an exciting and important time in your pregnancy journey. By now, your body is working hard to support your growing baby, and with the right care and attention, you'll help ensure a healthy pregnancy. Remember to schedule that first prenatal appointment, take your vitamins, eat well, and get plenty of rest. And don't forget to listen to your body. If you found this video helpful, make sure to subscribe and click the bell icon for weekly updates on your pregnancy journey. You've got this.